rehab integrated medical solutions. Let's talk about RIMS India. RIMS India is our brand name and it is a unit of Retirement Medicine Private Limited. So RIMS India aims to bring all medical and allied health professionals in one single medical platform for efficient, evidence-based patient care. RIMS India medical platform offers several key features such as online patient scheduling, complete medical history storage facility which can be viewed and reviewed before seeing any patients by all the healthcare professionals. Then you can do complete medical examinations and all other examinations digitally, generate e-prescriptions. That means after your examinations, you can proceed for e-prescriptions and you can establish after your diagnosis, you can generate e-prescriptions as per your disciplines. And these disciplines means for medical doctors, for homeopathic physicians, for Ayurvedic physicians, and all our rehabilitation professionals are all physical therapists, occupational therapists, and speech therapists. And make a profile, then you can directly get a dashboard. And when you get a dashboard, then you are connected with all the doctors, nurses, and all the rehabilitation professionals. That means in acute, subacute, and chronic or outpatients, wherever they are working, you can see their medical records, what exactly they are doing, what kind of treatment, what kind of examinations, and what type of diagnosis they have done. You can review through patients' medical records. One of the things I want to say here that we have given supreme importance to the patients. If you see right now that every hospitals, they have their own portal, so you will not be able to get all the records and everything. But when patients has independent medical records, so that what they can do is when they come to you, you can review their medical records so that you can treat the patient properly. And this is a simple systems how the patients or any individual can do their registrations in our system. And after login and registrations, they can complete their profile setting. And in profile settings, they can put their or fill up their medical history. So there are 3 types of medical history we have included in our system. One is past medical history, your present current conditions, and as a physical therapist, you can see your current functional status and what is exactly the current problem is. So that will definitely, after reviewing the system or after reviewing the functional status, the therapist will know that what exactly the patient's problems are. Then I would like to discuss about the rehab operation system, how we have designed for smooth operations of the non-clinical paperwork. So in our rehab operation systems, your patient can make online appointment when you are in the system. And after making appointment, you can review their medical records ahead of time, what exactly the problem is and why they are coming to your clinic. And this is the complete physiotherapy operation system. And after you get a dashboard, you can view your list of patients scheduled for that day, and then you can view and review all the medical records before even see the patients. And after that, you can generate the e-prescriptions. And when you go to your e-prescriptions and you go to your manual therapy or whatever treatment you are providing, and then you can go to your whatever exercise program you want to give it to the patients. Next slide, I would like to take you to the orthopedic physiotherapy examinations in this category. Then neurological physical therapy examinations in this category. And this is rehab ongoing patient treatment, because when a patient comes to a doctor, they come after maybe 3 weeks or 4 weeks or 5 weeks or 6 weeks. But when a patient comes to a physical therapist, maybe you have to come 2 times a week or maybe 3 times a week. So every time you come to a physical therapist, we have designed in such a way that they assess the problem, what exactly the treatment benefits it was, the previous treatment sessions, if there is any problems or there is a new problems, everything they can re-examine, and then they can design or update the treatment plan according to the patient's problem specific. And one of the good thing is that it can, all the problem areas, again, it can filter to the assessment areas, and if there is any new diagnosis, and they can use again the ICD code. So this is really a new concept that we try to do all in one digitalized system, so that we have given the supreme importance, the rehabilitations we have included in the medical, so that every doctors, they can see that what exactly the advancement that we have done so far in the field of rehabilitations. Because there is 2 areas. Medical doctors, they look at the pathology, and rehabilitations professionals, we look at the impairments. And if we connect this together, only then you can see the complete success of the patient care. And thank you.
Thank you, sir.
Thank you, sir. Thank you for your inspiring words. May I please request our chairpersons, Dr. Reena and Dr. Mahesh, to kindly felicitate Dr. Samir Paman.